Great. Well, good morning and welcome to the 9:30 call. We're so excited this morning to hear from Jeremy Rosen, and we'll have Jeremy tell us a little bit about him and how he came to this role at Strategies. He's been our project manager, working on the early childhood agenda, and he is also graduating with his master's degree. Is it this weekend?
Yeah, this week.
This weekend. All right. So I'm going to spotlight us for the tell us about yourself part, Jeremy. And then I know we're excited for your update.
Great. Well, thank you so much. I'm excited to be here to share about some of the work I've been doing this past year between both the early childhood agenda and my schoolwork because they matched up perfectly. So my trajectory to this work's kind of a funny one. We can go all the way back. I studied undergrad at Skidmore College, so we share that. And I thought I wanted to be a geologist, so I studied geology, and then got my master's in geology, and that was in Washington at Western Washington University, Washington State. And while I was there, I kind of I was in this new community and wanted to find ways to get involved in my community. And I had worked with children in the past in a variety of ways. I was a substitute teacher, camp counselor. So I thought a really good way that I could kind of bring my background in science and interest in working with kids together would be to work in after school programming. So I worked for the Boys and Girls Clubs for a few years, and I ran science programs mostly. I was really fortunate to be there when they got a grant to start a STEM program. So I was the STEM coordinator and built that program and designed the curriculum. And then during COVID, of course, a lot of things changed and we all went through those changes. And I was very fortunate to be able to stay on the team at the Boys and Girls Club and became a club director while we were kind of reopening and rebuilding. And that was really an eye-opening experience for me because I started working with families more directly, understanding what some of the things they were going through were, also understanding some of the issues that the workforce faces more acutely, and became more and more interested in that. And a friend of mine, I was probably venting to her. She had just graduated with an MPA, and she's like, "Well, you should consider going back to school. This is something you're really passionate about." And so I did that and went back to Brandeis to get my master's in public policy, with a concentration in child, youth, and family policy, and particularly interested in issues that the child care workforce faces and early education workforce.
And then tell us a little bit about how you came to Strategies and kind of what you've been doing with us.
Yeah, so for my program, one of the things that we do, it's a 2-year program. So in the summer, we find an internship, and I was kind of looking around at different organizations. And to be honest, I reached out to someone at another organization, and they had worked with Titus, and they put me in touch with Titus. And Titus shared with me what was going on with the early childhood agenda and that they were looking to bring on some project managers. And we discussed some of my work and what I was interested in, and it just seemed like a great fit. And then we kind of just hit the ground running over the summer, and I've really been learning on the job. I really can't express how much I've learned. Hopefully, my capstone is a small illustration of how much I've learned working with the strategies team. But yeah, so I've been a project manager for the past year, helping to facilitate the early childhood agenda, and my main focus has been on work group 2, which is our work group to advance compensation for early childhood professionals. And we've been mostly focusing on education and care, but I know that we've been talking a lot about how do we sort of make this more of a holistic look at early childhood and thinking about early childhood professionals in other fields as well.
Thanks, Jeremy. And so our team got to virtually attend Jeremy's capstone presentation last week. And so we're so happy that you'll do a 30-minute, now 21-minute, 22-minute version of it. We know we'll have your slides, and we know that you have just contributed so much to work group number 2, and we just so appreciate all that you've done. And special shout out to Marissa, who really was the leader of for Jeremy and Amanda when they were with us, and did incredible work the last year. So back to you.
Great. Well, I'm going to share some slides if that's okay. Can everyone see that? Great. I'm going to go into some details and kind of what my guiding question was for this capstone, but I kind of want to start with just a really simple figure because we know that this system can get so complex, and I think it's helpful to sort of break things down. So this is a figure showing average annual wages in Massachusetts in 2023 by occupation. The data is from the US Bureau of Labor Statistics. And first, I want you to look way over to the right at the red rectangle, which is the required after-tax income for one adult and one child in Massachusetts. So we see that it's like just above $90,000 a year. And as we move left, we have average annual wages in the state for kindergarten and elementary school teachers. And as we continue to move left, we have those early educators who serve the youngest of our residents here in Massachusetts, the early childhood education workforce. And of course, this is a workforce that is working with children, as all of us on this call know, during one of the most crucial times of development. And so I think this is a really shocking illustration of the problem that I'm here to talk about today, which is poor compensation for this field. I also want to acknowledge that compensation isn't just wages and salaries. There's benefits, there's working conditions, there's career pathways. I'm going to focus on wages and salaries today, but any real solution is going to have to consider all of those things. So that's the topic of my capstone, improving compensation for the early education and care workforce. Really what I wanted to do was bring all these conversations together because this is being talked about at the early childhood agenda, at Common Start, in the legislature, so many different places. And so what I wanted to try to do was bring this together, explore what some other states are doing, and see if there's some potential policies that the state could implement. And as Amy said, I really need to shout out Marissa, who was my reviewer for this, and I could not have done this without her. So a lot of us on this call are very familiar with this workforce, but if you're here and you're not as familiar, the early childhood workforce serves children from birth to age 5. And here in Massachusetts, we have a mixed delivery system. So they might work at family childcare programs, center-based care, and school districts, and there's all different jobs. Some folks are owners and operators, lead teachers, assistants, or administrators. And there's always the question, of course, well, why does this matter? Why should we care about the compensation for this field? And the way I like to think about it, and I'm going to steal this metaphor that I think I actually heard on a 9:30 call earlier this year, which is that the early childhood education workforce is like a keystone species in an ecosystem. And in order for any ecosystem to thrive, you need the keystone species to thrive. And if they aren't, it impacts the entire ecosystem and ripples throughout the ecosystem. And that's what we see in Massachusetts and nationally, that there are a wide range of impacts from this workforce being poorly compensated. Of course, that starts with decreased economic well-being for workforce members themselves, which leads to them needing to rely on benefits from the state that increase costs for the state, and of course, burnout. And that burnout leads directly to lower retention and high turnover in the field. And that, of course, impacts child development. We also know that low retention and high turnover decreases the capacity of the system. And we saw during COVID, especially, but we also know that this was an issue for many years prior to COVID, that when families can't find slots for their children, it disproportionately impacts mothers who are more likely to leave the workforce. So there are, of course, gender equity issues here. Not to mention that the workforce is in Massachusetts, over 90% women, and a disproportionate amount are women of color. So massive gender equity issues. And the low capacity of the system is an impediment to economic activity for families, communities, the state, and nationally. So what I wanted to first do in trying to look for some solution, and we did this in our work group too as well, was really explore what's happening in other states and try to find some patterns. So what components of policies implementation do we need to create a successful program here to solve this problem. And these are some of the different components that we identified. So for example, there was a shared vision. What do we want the North Star goal for these policies to be? And a timeline. They always involved, if they're successful, community engagement. So events like this, different ways of involving the workforce and advocates to inform these policies. So ultimately, that collective action piece. There need to be a way to identify revenue and different funding sources. Cost modeling was a big piece of this. So understanding what is the, maybe I'll put in quotes, true cost of providing high quality, accessible, affordable care that also pays its workforce at least living wage and ideally a thriving wage. Necessary data collection, and I'll get to that a bit more later. And then of course, at the end of the day, what are the actual mechanisms? What are the programs to improve compensation? And so when you look at all the different ways that some states have done this, there's countless numbers of examples. And I want to discuss two models in particular that are going to be most relevant to policy options that I will propose. So the first is this component of wage scales. A lot of you are probably familiar with this. The idea is that there's a minimum wage that is often tied to living wage, and educators have the opportunity to move up a career ladder, potentially through different pathways like education, other measures of competency, work experience. There's a lot of different models in different states, but they're reaching some sort of target maximum wage that's often we see is tied to pay parity with K through 12 salaries. Another model that a lot of states looked at that I thought was worth exploring was tax credits. So you file your taxes in April, and if you are eligible for a tax credit, and if that tax credit is refundable, like the child tax credit or the earned income tax credit, and the value of that credit is more than what you owe in taxes, then you actually receive that difference. And so these are some different models of tax credit programs for early educators in other states, one from Colorado and one from Nebraska. And what's interesting about these is that we see that they kind of adopt a similar component as the salary scale model in that they allow educators to move up that career ladder to receive a higher tax credit level. One really positive thing about tax credits is that they aren't taxable income. So we know that a lot of this workforce are eligible for benefits. And one of the fears about raising salaries is how would this impact the benefit cliff? Would all of a sudden a lot of educators not have access to those benefits? So tax credits is one potential way to be thinking about that. And then in implementing these types of models, we also observed that states had to adopt other things. So for example, there was always a workforce registry so that they could collect necessary data on current salaries, education levels, work experience, that kind of information. And then some sort of consistent credentialing system that allowed for multiple pathways to really reflect the different ways of gaining competency in this field. And then there were often eligibility requirements, especially to promote higher retention and to kind of cut down on turnover. And one of the ways that these policies do that, for example, is they often require staff to work at the same site for at least 6 months in order to be eligible for these programs. So those are some of the models that we were looking at. And of course, if we're going to start thinking about how this can transfer over to Massachusetts, it's important to think about what's actually happening here in the state. So the state does have a lot of different policies to support this workforce. Most of them, however, aren't targeted specifically at increasing wages. So we know there's different policies to support career pathways, to help pay back student loans or provide childcare subsidies for members of the workforce with children and childcare. But the one I really want to talk about that, again, a lot of us on this call are familiar with is the C3 grant program. So we know that this is a non-competitive grant program that the state fully funds at about $475 million a year, and eligible programs apply, they receive grant funding, and they have pretty considerable discretion over how they want to use these funds. And what we see from the C3 survey data is that about 66% of funds are used for workforce supports. And a significant amount of these go towards increasing wages and salaries. And so this figure here is showing average educator, highest and lowest hourly pay over time. So each of these different colored rectangles is a different position in the field. And then the clusters of wages on the left for each of those are wages and salaries prior to C3, and the clusters of wages on the right are wages after implementation. And we see it's pretty clear that with the implementation of the program, wages did tend to increase, but they only increased about $2 an hour because we know it's so expensive to run and stabilize programs. So owners and operators are, walking this tight line of trying to keep their programs open, keep costs for families down, and pay their staff. So it's hard to have significant increases in wages. We also saw from the C3 data that increases in wages were highest for center-based care workers. So they were lower for family child care workers, and they were also lower increases for staff who were serving more low-income families. So there's certainly something to work with here as a program, but some areas for improvement. Another component that I wanted to highlight for Massachusetts is the cost estimation study that EEC partnered with the Center for Early Learning Funding Equity to work on. And this essentially helps us to understand, again, I put in quotes, the true cost, at least a more accurate cost of providing early education and care, and can be used to provide recommendations to improve care funding and education funding in a way that reflects having a system that is affordable, accessible, and compensates the workers in the field at a more appropriate degree. And the cost estimation study that the state put together did include wage scales that they proposed, and the minimum here was tied to living wage from the MIT living wage calculator for a family of, I think it was 1 adult, 0 children. So that might raise some questions for folks. It certainly does for me, and we can talk about that. And then the target maximum wage again was K through 12 parity, and they produced wage scales for both center-based care and family child care. So that could be something helpful to work with. And then another ongoing initiative in the state is this transition to having a credential throughout the state. So what this figure here is a draft credential from EEC that I think was proposed or at least maybe not proposed, but brought up in 2021. And what I want to highlight is that there's the 2 pathways to increasing the credentials, the work experience path and the degree path. I'm not necessarily proposing that this is the best way to do it, but I do think it's really important to acknowledge that there's such talent in this field, and competency can be obtained in a variety of different ways. So we were talking yesterday, for example, New Mexico was working on their multi-path career ladder and working on figuring out a way to measure competency other than just degree path. Work experience is one way of doing that. I'm sure there are many others as well. But again, something we can at least be working with as a template. So next, what I want to do, I think hopefully I have time, is go through 3 policy options that I thought the state could consider based on these models. And I sort of rated them based on evaluated them based on 3 criteria. The first, I produced a cost estimate. I want to emphasize that these are very back of the napkin cost estimates. We sort of don't have the data yet to make more accurate cost estimates based on these policies. So hopefully this can provide a ballpark idea how much they would cost. Political feasibility, so particularly how do these programs fit into the current programs and legislative initiatives in the state? And would they potentially receive support from legislators, advocacy groups? And that's many of you on this call today. So if you're like, I'm not sure I agree with your assessment, I would really love to hear that. and of course, members of the workforce. And then perhaps most importantly, what's the reach? Roughly how many members of the workforce would actually be impacted by these policies? So the first potential option is state implementing an early education and care workforce tax credit. So this would be a refundable tax credit with benefit values that could increase based on a multi-path schedule that increases compensation with credentials or perhaps experience. And again, this could be tied to a minimum time eligibility requirement to incentivize retention in the field. This is something that's not really being talked about as much here in Massachusetts, so it's a bit of an unknown, but I think worth considering. All right, there's a lot on this slide. This is the second option. So I'll go through this and kind of hopefully can turn your attention where you should pay attention. But the option here is to increase funding to C3 to ensure that programs can pay their workforce in line with a salary scale that the state would have to determine. Of course, again, this would require a significant investment into the C3 program. And it could tie eligibility to receiving the grants to paying that scale, paying staff in line with that scale, of course, depending on funding. This would also require an update to the current workforce registry, which I know is something that EEC is working on so that we could collect the necessary data. And it would mean the development of a wage and salary scale. So for example, that could be tying minimum wage to living wage and maximum again to K through 12 parity. Although I think we should really be thinking about how we can start to think about sort of expand past K through 12 parity to a thriving wage. And I can talk a bit about more of that later too. In terms of how we would actually do this, one way is sort of looking at the C3 funding formula and particularly looking at the staffing level adjustment, which sort of is a way of figuring out how much each program is going to get from the grant based on how many staff they have. And what we could do is amend the staffing level adjustment similar to what Washington, D.C. does in their pay equity fund, where they consider the difference between current salaries of staff and the minimum salaries by role and credential. So this would correct the staffing level adjustment to consider how much wages would need to increase to be able to fulfill that salary scale. So that's option 2. Option 3 is sort of what I call the status quo option, which is developing a salary scale for recommendation. So there's currently a bill in the legislature that essentially requires C3 recipients to pay their staff in line with the salary scale, quote, to best of their ability. But we know that if they're not receiving the necessary funds, that essentially that's a recommendation. But that could be seen as a step in the right direction. And the state can also help with programs that are interested in implementing that salary scale, either fully or partially. And so again, potentially a step in the right direction. And this is the type of program that's implemented in North Carolina as well. So those are the 3 options. What I want to quickly do is just sort of touch on how I consider these in my evaluation criteria. So for the workforce tax credit, I estimated this would cost somewhere between $30 to $160 million, which really depends on the type of model we implemented and where members of the workforce are distributed in a potential salary scale. Of course, this doesn't really fit into current initiatives and legislation that's in the legislature right now. So I don't know if it would receive much legislative support. I am thinking in terms of advocacy support, probably moderate, but not necessarily enthusiastic because again, of that lack of fit. But in terms of workforce support, again, a big pro of this type of policy is that it doesn't impact the benefit cliff. And then in terms of reach, I estimate it would reach about 75 to 80% based on the earned income tax credit uptake, which basically means about 75 to 80% of people in Massachusetts who are eligible for the earned income tax credit actually receive it and enroll in it. So the second one, increasing funding to C3 to ensure compliance with the salary scale. this would be a significant cost of about $400 million. So that's essentially doubling the cost. And I know that can seem like a high price tag, but it helps me to remember that we're trying to solve the issue of chronically underpaying a large workforce over, I think, about 34,000 workforce members in the state. That's going to cost money. It should cost money. And we saw from the ecosystem metaphor that when we invest in this workforce, we're also investing in a lot of other things. So the cost may seem high, but the benefits are likely much higher. And of course, this fits really well with current programs and likely would receive support from advocacy and workforce groups. And I estimate would impact about 93% of the workforce based on what the current enrollment in C3 is. And then lastly, really quickly, for the development of a salary scale for recommendation, there would be no additional cost. So it would probably see a lot of support from the legislature, fits well into current initiatives happening in the state. But in terms of advocacy and workforce support, doesn't necessarily translate to increases in wages. So kind of hard to be enthusiastic about that kind of policy. So what I ultimately propose is for the state to think about a two-phase plan. Phase one would be to update the workforce registry so we can collect necessary data, use that data to establish a credential and salary and wage scale with multiple pathways, and then first recommend use of that wage scale to providers so that they can become familiar with it and receive technical support to use it, and then ultimately increase funding to the C3 grant program and update the staffing level adjustment in the funding formula so that C3 recipients can pay their workforce in line with the salary scale. So sorry, I had to kind of cruise through those last few, but I would love to hear feedback if we have any time. Oh, we're out of time. I'm so sorry.
Well, Jeremy, there's lots of good questions in the chat.
Yeah.
I don't know what you're doing tomorrow morning at 9:30, but we have updates in the field. So if you want to join us tomorrow morning, I'll send you the questions tonight. You can share your answers tomorrow. There's lots of 9:30 called love in the chat. And I think just, to have your capacity to really look at this as a student, but also as a member of the early childhood agenda, and kind of a leader of the work group, has just been such an incredible mix. Marissa, I'm going to give you the last word to offer today.
Thank you, Ayo. I was going to say, as the facilitator of updates from the field tomorrow, I'm thinking we should dive into this topic a little more and we can just discuss this. So if anyone wants to return tomorrow morning, I think we're going to start here at least, and then we can hear any other updates that folks have. But great presentation, Jeremy. We are so thankful for all of your work moving this forward. Yeah. And then I told Jeremy this yesterday, but just as like a bigger picture comment, I think it's so excellent that higher education and the work that Jeremy and his classmates are doing has such a real impact on current policy and the discussions that we're all having. So just wanted to reiterate that and how powerful that was to be able to work with him and his other classmates as well.
And Jeremy, what's one thing that you learned in working at Strategies that you couldn't have learned in a classroom at higher ed?
It honestly is really hard to choose. Like, there's so much. I think the main thing is being able to meet with providers on a regular basis. So, when I'm come to the group with potential ideas, and especially the family child care providers, to be honest, who have sort of pointed out ways that policies that might seem interesting don't necessarily map onto the business model of family child care, has been just so valuable for me for understanding the system.
And Leah Cooley is on the call sending you chat.
Oh, yeah,
and I believe the term thriving wage came from a work group 2 discussion.
Oh, totally.
Is that right?
Absolutely. I mean, yeah, Leah and Marlo are lived experience leaders. They've just been basically teachers, professors for me. So
we will leave it there, Jeremy. Thank you so much. We so appreciated all that you did. You're such an incredible part of our team. We will miss you, but wishing you well. Tell everybody what you're doing next.
Yeah, I'll be staying in the field, moving sort of into more of a research role, but going to be staying in early childhood policy. So I'll still be around, mostly focusing on Massachusetts. So I'm sure I'll see many of you.
Where, be specific. Where are you going?
MEF Associates. They're based in Washington, D.C., but they have a strong Massachusetts team I'm excited to be a part of.
Great. So we got one more in the field. So that's great. We convinced you to the other side. So Jeremy, thank you. Marissa, thank you. And we will see. So Marissa will be facilitating the updates in the field tomorrow. I put in the chat, we have 9:30 call in Spanish tonight, 9:30 call at night tomorrow. Both at 6:30, both using the same link. Please spread the word. I put the link in where you can see we have incredible guest speakers for both calls tonight and tomorrow. We will see everyone tonight, tomorrow morning, and tomorrow night. Have a great day. Take care.